This is Dr. Mapakshi at Wellness Empty Care. Today, I would like to talk about the risk of atrial fibrillation with chronic omega-3 supplementation. So, in general, we've always considered omega-3s to be good for you because they have so many anti-inflammatory properties, they have lipid-lowering effects. There has been enough data to suggest that even after post-operative, usually there is an increased risk of atrial fibrillation in the post-operative period. And there are studies that show that taking omega-3s in the post-operative period decreases the risk for atrial fibrillation. So in the recent past few years, there has been a large number of studies looking at omega-3 supplementation and cardiovascular outcomes. And they found that there was an increased risk of atrial fibrillation in people who have been taking omega-3 fatty acids. And the risk has been significant in patients who are taking more than 1 gram per day, and also in patients who have a history of MI. So it probably has protective response in people who are younger, people who don't have cardiovascular risk, but in people who have a history of cardiovascular disease and who are taking high doses of omega-3s, we need to be careful and monitor for an increased risk of atrial fibrillation in those patients. So again, as I have always said, supplementation and taking the same thing in diet can be two entirely different things. For example, with calcium, we know that calcium supplementation increases soft tissue calcification, which is again bad for overall health and inflammation. But if you take calcium in diet, it goes into the bones where it needs to go. It doesn't cause that much amount of soft tissue calcification. Similarly, omega-3 fatty acids definitely has an important role to play in your health, but you need to know when to take, how much to take. Okay, so the supplementation approach would be, you have to weigh the risks and benefits and also make a personalized treatment for each patient depending on what we are dealing with. So there has been a randomized controlled study, a meta-analysis actually, of 7 randomized controlled studies, which has been published in the Circulation in 2021, which showed the increased risk of atrial fibrillation. And so, my suggestions would be, 1, talk to your doctor before you take omega-3 fatty acids. There is always the option of checking to see how your omega-3 fats are and if there is a need for supplementation. And even if you are taking supplementation, I would recommend keeping it to less than 1 gram per day. Take it for a longer period, but at a lower dose consistently. And last but not the least, make sure that you incorporate other healthy lifestyle changes like weight management, movement, avoiding alcohol and smoking so that it doesn't increase the risk for atrial fibrillation. I hope this discussion has been helpful when you're choosing to take, decide which supplements to take and what not to take. See you soon.